To conclude, the SirPAD trial is the first device trial that was powered to test for clinically relevant endpoints. Good morning, dear colleagues. My name is Stefano Barco. I'm an interventional vascular physician and internist from the Department of Vascular Medicine of the University Hospital Zurich in Switzerland. I will summarize today the key aspects and results of the SirPAD trial, which has been published 3 weeks ago in the New England Journal of Medicine and is available online. So we designed in 2018 the SirPAD trial to answer a clinically meaningful question, namely whether a single device, in this case a sirolimus-coated balloon, could provide an advantage in the trial against a plain old balloon, so uncoated balloon, in terms of our clinical endpoints. This was an all-comers trial that randomized 1,252 patients screened at 44 centers in Switzerland and referred to 2 trial sites. And the patients were randomized to receive either sirolimus-coated balloon or uncoated balloon after having crossed the lesion and a standard pre-dilatation. The treatment occurred in the cath lab, and the dilatation lasted 120 seconds in both groups. It's important to emphasize that patients that were considered for randomization were enrolled based on a single eligibility criterion, that was the need for endovascular treatment, but we didn't have any additional eligibility criteria in terms of PAD severity, PAD anatomical location, and PAD or patient characteristics. So we managed to randomize 1,252 patients that composed the intention to treat population, 626 per group. Those were characterized by a median age of 75 years and, most importantly, by a prevalence of critical limb ischemia of about 45%, including almost 30% of patients with critical limb ischemia and 7% of patients with acute limb ischemia. The use of any other device was allowed in this trial, including bailout stenting, and the prevalent use of the bulking device or additional device was similar between the 2 groups. The primary outcome was a composite of unplanned major target limb amputations or target lesion revascularization for objectively assessed critical limb ischemia. This was assessed at 1 year and occurred in 8.8% of patients in the sirolimus group versus 15% of patients in the control group. And this difference that was assessed with a median unbiased estimate and quantified in minus 4.9% was statistically significant for non-inferiority and for superiority. And what is most interesting is that we confirm the same direction of the results for the 2 main components of the primary efficacy outcome, namely unplanned major amputation and critically limb ischemia leading to urgent target lesion revascularization. By doing the superiority analysis and confirming the statistical significance, we were then allowed to test for superiority for a second so-called key secondary outcome that was a bit broader compared to the primary outcome. So it included all target limb amputations, so minor or major, and all target lesion revascularization, including critical and non-critical ischemia. And the analysis of the secondary outcome confirmed the same direction of the results, with a difference between the 2 groups amounting to up to almost 8%. So the sirolimus-coated balloon-treated patients actually achieved a better outcome also in terms of the key secondary outcome. In this trial, we assessed all-cause mortality at 1 year, and we did not find any difference between the 2 groups. So to conclude, the SirPAD trial is the first device trial that was powered to test for clinically relevant endpoints and show the superiority of a balloon over another, in this case the Magic Touch sirolimus-coated balloon versus uncoated balloon, in terms of our clinical endpoints. And what is also reassuring is that all the secondary analysis and the secondary outcomes point to the same direction, namely a consistent reduction in terms of target lesion revascularization, target limb revascularization, and unplanned amputation, major or minor.